Alrighty, so hello and welcome to the Board of Health meeting for February the 5th, 2019. I would like to remind everyone that our meetings are web streamed and televised. For those in attendance, I would ask that you ensure your phones are on silent mode. Are there any declarations of pecuniary interest? Okay, seeing none, we'll move to the approval of the agenda. I have a motion moved by Councillor Van Passen and seconded by Councillor Columbus that the Board of Health agenda be approved as presented. All in favor? Carried. Okay, next, to the minutes. Are there any errors or omissions? Okay, if not, the Board of Health minutes for January 15, 2019, having been circulated and no errors or omissions reported, be declared as adopted and signed by the Chair and County Clerk and affixed with the corporate seal. First up, we have a presentation by Dr. Shanker. Dr. Shanker, if you could make your presentation.
Sure. Thank you again for allowing me to share my perspective and offer a few remarks today. I want to talk today briefly about three issues. One is about immunization and, as an illustrative example, measles, opioids and its challenges that our community faces, and access to mental health services. In the first instance, I'm grateful and I would ask for your continuing support for vaccination and immunization. It's one of the cornerstones of public health, and it's one of the things that definitely saves lives. I want to share with you the struggles that historically we've had with measles and our successes to date. Prior to measles immunization, millions of people died of measles. And in the last year in Canada, there were about 30 cases of measles. Measles is a disease that is a disease of children. It's associated with fever, runny nose, sore throat. But some individuals ultimately get swelling of the brain, and a small percentage of them die. In fact, about 1 in every 500 people who contracts measles, on average, experiences a death. And I think our immunization programs have been successful at ameliorating and mitigating measles-related illness and death. We have, as you'll hear today, you'll hear about our vaccine prevention program and our vaccination program in the county. I think our core message would be that not only does vaccination help the person who may be affected by the disease, but vaccination also helps the broader community because it helps prevent the disease from spreading to the small group of people who cannot be immunized. And this is in part what we consider the construct of herd immunity, the idea that we can actually improve the health of the population. So my core message related to measles and vaccinations is that you're ambassadors as members of the Board of Health and as the chair of the Board of Health in advocating for vaccination. I know there's a lot of dialogue about why we shouldn't vaccinate individuals, but I think the wealth of evidence supports vaccination as a strategy. The second thing I want to speak to you is about something that might have been more topical. You may have read that the Board of Health has articulated the issues related to blue fentanyl. So what do we mean by blue fentanyl? First, some context. Opioid addiction is a problem in Norfolk County. It's a problem in Haldimand County. It's a problem throughout the province. And when people use opioids, they can use it in a variety of formats. That could be oral, meaning swallowing it. It can be inhalational, meaning burning it or using it as a vapor. It could be injectable, and it could be injected under the skin, or it could be injected into the veins. In our health district, in our geographic zone, people are using fentanyl, hydromorphone, heroin, oxycodone. And typically when people use opioids, they may mix them with other opioid or other illicit substances. So how does this get to blue fentanyl? Whenever we get word that there's a difference in the quality or the difference in the opioids that might be available to people using them illicitly, we are worried. Now, typically opioids that are available on powder or solid format are adulterated already. They don't come as the pure opioid. They're many times mixed with a lot of other substances, some which may have physiological activity, some may not. And when there is the blue coloration, we worry that it's been adulterated in another way. So from the Public Health Service, what we're really interested in is in a non-judgmental way for those people who are currently using illicit opioids or illicit substances, that we can keep them as healthy as possible. And in part, that's our hope is that we can get them onto rehabilitation services. So our advice has been, and continues to be, when people use opioids, especially during events like our acknowledgement that there might be blue fentanyl, is not to use opioids alone, to have a naloxone kit available, not to mix drugs with other illicit substances like alcohol or methamphetamines, and hopefully to try to use as little of the medication or the drugs as possible. So we have a plan for blue fentanyl, and I hope that you've heard our radio announcements regarding opioid use and misuse. The third item I want to update you on today as members of the Board of Health are our obligations as a Board of Health and myself as the Medical Officer of Health to interface with the local health authority related to services and programs. In the few months that I've been here, one of the things that's become apparent to me in my dialogue with colleagues and with Nancy Gable, who's the medical director of the Norfolk General Hospital, and with other physicians, is that really one of the big challenges we face in this geographic zone is the lack of access to mental health services. Now, mental health services include physician services like psychiatrists who can prescribe medications, but also to non-physician services like psychologists and other individuals involved in mental health programming. Towards that goal, the Public Health Service and we have met and are going to continue to advocate for improved access to mental health services. Incrementally, yesterday I met with Dr. Maxine Lewis, who is the Chief of Psychiatry at St. Joseph's and Niagara Health System, and Dr. Gable and I went to meet with her. I think that we will try to continue to engage with the local health authority and to try to work on improving access in a timely manner for people who require mental health services. The one thing I'd like to close with is that access to mental health services is also important relative to addictions. To the extent that a number of people who are currently addicted or suffer from addiction also have concurrent psychiatric illness. If we're not able to manage the psychiatric illness, I don't think we'll have too much success with managing their addiction. So with that, I thank you for giving me this opportunity to speak, and I think you'll be hearing some exciting things from my colleagues throughout this meeting.
Thank you very much, Dr. Shanker. So I have a motion that has been moved by Councillor Columbus and seconded by Councillor Van Passen that the update by the Acting Medical Officer of Health be received as information. All in favor? Thank you, sir. Okay, next on the agenda, there are no consent items for today's meeting, so we'll move on to the discussion items. The first is the Smoke-Free Ontario Act of 2017. Staff could present their report.
Thank you, Madam Chair. I'd like to introduce to the board Ms. Line, who is our Program Manager of Community Health, and Amy, who is one of our tobacco enforcement officers. And the two of them will be presenting to the board this afternoon.
Okay, great, thank you. So we have some slides that you'll see in front of you. You can follow along with us. But basically the purpose of this information, it is an information report, and the purpose of this report is to inform you of the new Smoke-Free Ontario Act 2017, which came into effect on October 17th, 2018, and has replaced the old Smoke-Free Ontario Act 2006 and the Electronic Cigarette Act of 2015. So as a high-level overview, the Smoke-Free Ontario Act 2017, it regulates the smoking of tobacco, smoking or vaping of cannabis, as well as the vaping of any substance in prohibited places, as well as sale, display, and promotion of tobacco products, e-cigarettes, and e-juice. So just moving on to the, oh, have we got the clicker? Thank you, Amy. So just while we get that working, I can... Oh, it was working. Sorry, that's okay. So I'll just continue on while they work on that slide. So it is the Board of Health's responsibility to enforce the Smoke-Free Ontario Act. And so we do that through our tobacco enforcement officers at the health unit. It's set forth in our Ontario Public Health Standards and our accompanying tobacco, vapor, and smoke protocol of 2018. So the health unit does receive specific funding from the ministry. It is a 100% funded program. To date, we have stayed within the 100% funding with no net levy impact. So then here's just a quick slide just to go over the history of the expansion of the Smoke-Free Ontario Act over the years. So as I had mentioned, the original act was implemented in 2006. And over the years, they continued to amend the act, providing more outdoor spaces and providing more protection by including e-cigarettes over the years, which brings us up to our current, which is the new 2018 Smoke-Free Ontario Act. So in line with the increasing protection that comes from the Smoke-Free Ontario Act, we can see by this slide here that we've had a decrease in our rate of smoking, locally as well as provincially. So you'll notice we are the top, so we are still higher than the provincial average, but we have been decreasing our rates in parallel with the province with all of our efforts. In the next slide here, you'll see is the youth statistics. So youth statistics are a little bit trickier to come by, very small numbers, so we can't always give them with full, we do provide them with caution. But as you can see here, our youth statistics, they certainly have improved as well. So in terms of abstinence rates, so those youth who have never smoked a cigarette, we can see that that trend has increased, which is very positive. So we've gone from 83% of youth who have never smoked a whole cigarette. And then here, so while we have seen a lot of positives with rates decreasing, we still have a long ways to go with respect to promoting and protecting the health of our communities. So in 2014, you can see on this slide here that tobacco is still a leading cause of substance use, or a cost of substance use, in Ontario. It was second overall behind alcohol. So you can kind of see in that bottom left slide, I've put the red arrow there. So that would be tobacco, and it was at 32% of overall costs. And then in the top right corner, you can see there that 50% of those costs were associated with healthcare costs directly. So in terms of what's new with the Smoke-Free Ontario Act, there are some main pieces that are new. So what I'm going to do is pass it over to Amy, our tobacco enforcement officer, to sort of walk you through the pieces that are new that we're responsible for enforcing.
So with the prohibition of use, now the general rule is that if you can't smoke tobacco products, you cannot smoke cannabis or vape any substance. So for generally most of the places of use have remained the same. There are 3 places where I would like to expand on because their use places have expanded. So with restaurant and bars, you are no longer allowed to smoke or vape on any bar, restaurant, or patio restaurant, or within 9 meters of that patio. With school grounds, you're not allowed to smoke or vape on school grounds or within 20 meters of that property. We are working with the schools to ensure that that's being followed and that they are supported as much as they need. Recreational facilities, these facilities are places where they're enclosed and that they're owned by a level of government or a charity, and they provide recreational activities for children. So recreational facilities, you're not allowed to smoke on the property or within 20 meters of the property. The rest of the places have remained fairly the same, so in keeping with time, I'm just going to pass over those, but if there's questions, I can certainly answer them. Motor vehicles is a place where smoking tobacco is, or consuming cannabis is different than smoking tobacco. So smoking tobacco or vaping is prohibited in a motor vehicle with anybody under the age of 16 present. Consuming cannabis is prohibited in a motor vehicle except in certain situations. So those situations where consuming cannabis would be allowed would be 1, a passenger is a medical cannabis user, and they're consuming medical cannabis in a form other than smoking or vaping. So a medical cannabis user can use cannabis as in an edible form if they are a passenger. Cannabis can be consumed in a motor vehicle if it's equipped with permanent sleeping accommodations and permanent cooking facilities, and it's parked in a place that is not a highway, road, or driveway, and is being used as a residence. So that's an example of like a camper van that's parked in a camping grounds. You're also allowed to consume cannabis on a boat if it has permanent sleeping accommodations, permanent cooking, and permanent sanitary facilities, and that boat is anchored or secured to a dock or land and is being used as a residence. So a houseboat that is docked, you are allowed to consume cannabis in. So another part of the tobacco enforcement's role is to cover the display and promotion of tobacco products and vapor products. The display and promotion of tobacco products have not changed since 2008. You still can't see tobacco products and you can't promote them in any way. The selling and supplying of vapor products has changed somewhat, quite a bit actually, since October. So displaying and promoting, or displaying vapor products is now prohibited, and displaying vapor products is restricted. So what it is, promotion of vapor products, they have to follow the Federal Tobacco and Vapor Products Act, which states that vapor products cannot be promoted in any way that is appealing to young people or promote a vaping product by means of lifestyle advertising. So they can be promoted but not displayed. Another new change is that all vaping products, including e-juice, cannot be sold to anybody under the age of 19. Prior to October, it was just the device themselves, but now it's including all vaping products. Tobacconists and specialty vape stores, they are considered specialty stores. They have to meet certain conditions and they have to register with the Board of Health. That registration has just recently been delegated to the Board of Health from the ministry. There's certain conditions that they have to meet, and then they're exempt from certain rules. We currently have 2 specialty vape stores throughout Haldeman and Norfolk, so those stores will be able to promote their vapor products and display their vapor products. They will also be able to allow their customers to test and sample the products as long as they follow certain restrictions. Something to note is that people under the age of 19 are not allowed into these stores unless certain conditions are met. And we currently do not have any tobacconists in the area or anybody registered or trying to register as a tobacconist. So with new legislation, there becomes new signs. So these no smoking, no vaping signs are available to be printed off the ontario.ca website, and they are also available at the Health Unit free of charge. These are the signs that tobacco vendors and vapor product vendors need to have. These are also available to be printed off the website and be picked up free of charge from the Health Unit. And tobacco enforcement officers also carry these around while we're doing our inspections to provide them to the vendors. So there's certain mandatory inspections that tobacco enforcement officers must complete throughout the year. For tobacco vendors, they must have 2 test shops completed annually. So a test shop is when the tobacco enforcement officer takes a minor around and they try to purchase either tobacco products or vapor products. Tobacco vendors also have to have a display and promotion inspection where we check and make sure that we can't see the products and they aren't being promoted. For vapor product vendors, they are also required to have a test shop completed and a display and promotion inspection completed annually. Specialty vape shops also have to be test shopped each year, and they have to have 2 test shops completed. And then there will also be another inspection for them as well. Each secondary school has to be inspected at least once a year, and tobacco enforcement officers have to also respond to all complaints made under the Smoke Free Ontario Act. We also do as many proactive inspections as we possibly can, with time permitting.
So given all the recent changes in the legislation, our Health Unit staff have created a communication plan and have been working actively on implementing that in our community and with all the key stakeholders. What you see there is just an example of a public billboard that we had put up, just because we want to lead people to our Health Unit website for more information around the new legislation. As well, we're going to be working with the municipality on signage because we've received that more recently as well. So in conclusion, our Health Unit will continue to fulfill our mandate when it comes to enforcing and educating around the Smoke Free Ontario Act. We ask that this report please be received as information And at this point in time, we'd be happy to take any questions. Thank you.
Any questions? Councillor Columbus, or board member Columbus.
Thank you, Madam Chair. I've got two questions. One is, what do you do with the secondary school inspection? What's the procedure? Like, do you count cigarette butts, or what do you do?
So through the chair to the board, during a secondary school inspection, what we do is we go around and make sure that there's no smoking or vaping on the school property. And if there are, we are mandated to do a progressive enforcement approach. So we would talk to the students and provide education, and then if necessary, go with warnings and then charges. But that would be a long process. But the secondary school inspections mainly provide making sure that there's no smoking or vaping.
Okay, so I know I drive by some high schools, not necessarily in Norfolk or Haldimand, but you see students quite far away. But do you ever look at where those cigarettes came from? Like, do you look at packages, or the fact that a lot of them probably have been purchased on the black market? So do you ever do a survey like that to see where what the brand is on the butts? Or
So through the chair to the board, the tobacco enforcement officers don't do that. I've heard other studies that have done that, but the tobacco enforcement officers do not.
Okay, the last question I have is about your statistics there showing smoking statistics for youth showed a decrease, but those numbers were 5 years old. Do you have up-to-date numbers?
Unfortunately, we don't have any up-to-date numbers. The most up-to-date numbers we would have would be sort of provincial numbers that come through the Ontario Student Drug Use Survey.
Okay, thank you. Thanks, Madam Chair.
Any further questions? I just, the piece with the boat, so I know you can smoke on a houseboat, cannabis, but you can't smoke on a regular boat, is that correct? I had to have living quarters? Is that so you can sleep afterwards?
So through the chair to the board, the regulations do state that they have to have certain things like sleeping accommodations, permanent cooking, and sanitary facilities.
Interesting. I also find it interesting whoever wrote those regulations, I guess they've never heard of the term hotboxing before in the car. But thank you very much. So I have the motion. It's been moved by Board Member Columbus and seconded by Board Member Van Passen that staff report HSS 19-01 Smoke Free Ontario Act 2017 be received as information. All those in favor? Thanks. Okay, next up on the agenda is the Public Disclosure Program update. That's HSS 19-02.
Thank you, Madam Chair. I'd like to re-welcome Ms. Pongratz, our Manager of Health Protection, and with her presenting today is Ms. Kelsey Lutzy, who's one of our public health inspectors and a key lead for this disclosure project.
Thank you. I'm just waiting for the presentation. Oh, is it? Perfect. Okay. So through the chair to the Board of Health, it's a pleasure to be here today to provide you with an update on our public disclosure program. In 2018, the new Ontario Public Health Standards provided by the Ministry of Health and Long-Term Care outline requirements for public health units to implement a public disclosure program. This means disclosing inspection results, complaints, and information regarding infection prevention and control lapses and tobacco convictions. The goal of the program is to promote awareness, understanding, and public confidence in public health. And the outcome is increased transparency, which leads to public trust, providing information to the public, which allow them to make informed decisions about their health.
We have our notes up there.
So there are two components to the disclosure program. The first is the actual online website. So the name of our health unit's website is Inspect Our Community, and it successfully launched in January of 2019. This is where information from routine and complaint-based inspections for various premises such as restaurants, public pools, child care centers, and more will be posted, as well as information from small drinking water system assessments, information from infection prevention and control lapse investigations, and information from tobacco convictions. Oops. Sorry, we'll just get you on the right slide. It is important to note that only inspections, complaints, and information from January 2019 and onward will be posted. Information prior to January 2019 can still be obtained by calling our office. After an inspection or investigation has been conducted, information is posted within 2 weeks and must remain on the disclosure website for a minimum of 2 years. Small drinking water system assessments are an exception to this. Low and moderate risk systems must be posted for a minimum of 4 years as required by the Ontario Public Health Standards, and this aligns with their assessment frequencies. The second component of the disclosure program is the posting notice. So we're calling this our certificate of inspection. As of January, when a public health inspector completes an inspection at premises such as your restaurants, personal service settings, child care centers, and so on, a certificate of inspection is posted on site. It contains the information about the premises, such as the name, the address, the date the premises was inspected, and if a re-inspection is required. A new certificate of inspection is posted at each inspection, and the old one is taken down, brought back to the office, and shredded. The operator is required to post these notices where it is clearly visible to the public coming into their facilities. The certificate of inspection has a QR code, so when scanned by a smartphone, it will take the user to the health unit's disclosure website where they can see additional information about the inspection conducted and the premises itself. So a little bit on the development and implementation of this process. So the road towards the development and implementation of the disclosure program entailed us upgrading the Hedgehog software, which PHIs use to input data regarding their inspections and investigations. This software is what makes it possible for the information to be pushed to the disclosure website. We provided education to our owners and operators, so we created guidebooks for the respective program areas such as food safety and rec water, and these have been delivered to our owners and operators. PHIs also actively engage and educate our owners and operators while we're conducting inspections. We did stakeholder engagement, so we consulted with our legal, communications, and IT departments, as well as other health units with both established disclosure systems and those that were starting from scratch. All of these interactions helped develop our current program. And we have public education. So this has been done via social media, news ads, radio ads, and smart TV boards across both counties. Our promotional campaign to engage the public began in December ahead of our anticipated launch, and public education will be ongoing as new program areas continue to be disclosed on the website.
So our next steps are that we will continue to roll out additional inspection results this month. We'll also continue updating our inspection reports in Hedgehog to ensure they're reflective of the new legislative requirements. We're committed to providing additional education to owners and operators of premises and the public, and our team will be here to provide clarification about the program. We're also working on a program evaluation component. As this is a new program for the health unit, we'll be looking at the data that can be used to improve processes and customer service. And then, of course, quality assurance is important to ensure we have the necessary checkpoints to address issues, ensure accuracy of the information that's being disclosed, and in addition, we want to ensure there's standardized practices amongst our team. So with that, I'll ask that this information, or this report, be received as information by the Board of Health, and we'll open it up to questions.
Thank you. Any questions? Board Member Hoffman.
Thank you, Madam Chair. Just wondering if you've had any feedback from any, you know what I'm going to,
yes,
okay, go ahead, answer away.
It's somewhat surprising. As a PHI in the field, I am out there doing these inspections, and so far the owners and operators are quite happy to have this. A lot of people want to promote the good business we do have in Norfolk. They want to ensure that they're being transparent as well, and they want to work with us to ensure they are, meeting the necessary regulatory requirements, and we're definitely there to support them in that. If that means that sometimes not everything is 100%, that's okay, and we'll work with them to get there, but it's about having that consistent, standardized information for everyone. So we're really making sure we're letting the owners and operators know that it's going to be the same for everyone, but we'll also work with them. But so far, the feedback's been relatively positive.
Any further questions? There was just there was a second part actually to the staff recommendation, the continued advocacy for the continued funding. That's just from the province, I'm assuming?
Yes, we put in last year a one-time request for some funding to help us to implement the project. You know, that's something that we possibly are going to be looking at to put in for, again, another one-time funding request with the annual service plan when we submit that.
Any further questions? Okay, so the motion reads as follows, that staff report HSS 19-02 Public Disclosure Program Update be received as information, and that the Board of Health advocates for continued funding in 2019 to sustain the public disclosure program, including the components of website management, quality assurance, and promotion of the program. That has been moved by Councillor Van Passen and seconded by Board Member Columbus. All those in favor? Carried. Thank you. Okay, next up is the Haldeman Norfolk Health Unit Risk Management HSS 19-04.
Thank you, Madam Chair. I'd like to welcome back Mr. Okoronkwa, who will present the report.
Thank you. Good afternoon. Through the Chair, it's my pleasure to meet with you this afternoon and humbly request that the Board of Health receives Staff Report HSS 19-04, Haldeman Norfolk Health Unit Risk Management, and endorse the plan presented to meet the requirements of establishing a risk management framework. The OPHS mandates the Board to provide governance direction to administration and ensure that it remains informed about the activities of the organization with regards to risk management. The Board of Health is also expected to have a formal risk management framework in place that identifies, assesses, and addresses risk. This report will provide an overview of steps staff plan to take to incorporate a risk management framework into the operational practice of the health unit. What is risk? Risk is the chance of something happening that will have an impact on the achievement of objectives. It has been noted that risk can present as either an opportunity or a threat and is measured in terms of impact and likelihood. Appendix A shows the 14 risk categories identified by the Ontario Internal Audit Division. Now, risk management, on the other hand, enables organizations through the culture, processes, and structure to identify, manage, and/or mitigate risk. As shown in Figure 1, the framework under consideration will include the following steps. 1, establishment of a risk management objectives. 2, identification of risk and current controls. 3, assessment of risk and current controls. 4, development and implementation of action plans to control and mitigate risk. 5, continuous monitoring and reporting of these processes. Appendix B shows the proposed timeline for the implementation of the risk management program. In conclusion, as staff proceed with incorporating this framework into the health unit's operational practice, staff will continue to provide regular updates to the board. With that, I am happy to answer any questions members of the board may have.
Thank you, sir. Any questions? I think you're off the hook. Okay, so the motion I have is moved by Board Member Columbus and seconded by Board Member Van Passen. You two were busy. That staff report HSS 19-04 Haldeman Norfolk Health Unit Risk Management be received as information, and that the Board of Health endorse the plan presented in the report to meet the requirement of establishing a risk management framework. All those in favor? As carried. Thank you. Okay, next up, HSS 19-05 in regards to the Immunization of School Pupils Act suspension process.
Thank you, Madam Chair. Our final report for this afternoon will be presented by Ms. Titmus, who is the Program Manager for Infectious Disease.
Good afternoon. Through the chair to the board, I'd like to thank you for this opportunity to provide you with some information on our implementation of the Immunisation of School Pupils Act. As per the Ontario Public Health Standards and Protocols, the Board of Health is mandated to follow the Immunisation of School Pupils Act. This act was put in place to increase the protection of children against designated vaccine-preventable diseases. You'll find the list of those diseases located in Appendix A at the back of the report. Outbreaks of these diseases put vulnerable populations, those who can't be immunized, and those with weakened immune systems at risk and are costly to both the individuals, their families, and our communities in the healthcare system. It is thanks to these vaccines that infectious diseases that were the leading cause of death 100 years ago now cause less than 5% of all deaths in Canada. The Act requires that students attending primary and secondary schools be immunized against the designated vaccine-preventable diseases located in Appendix A or have a valid exemption on file. As our focus is on protecting students against diseases, we commenced our annual review of records for all students aged 7 and 17 years of age in January of this year. At this point, 1,821 letters have been sent out to parents and students with incomplete vaccination records on file. Several options have been provided to resolve immunization issues, and these include that if an immunization has been received but not reported to the health unit, that it can either be reported online via the ICON website, via fax, telephone, or in person at one of our health unit offices. Those who still require immunizations can receive their vaccinations at their primary care provider, attend a health unit clinic, and for high school students, we also offer high school clinics. Students with medical exemptions or conscientious or religious belief exemptions are also accommodated by contacting the health unit to complete the necessary paperwork and the vaccine education course. It is through this process that the health unit, and in particular the staff assigned to the Vaccine Preventable Diseases team, make every effort to avoid issuing suspension orders by working with our community to notify parents and students of their incomplete records, to work with our physicians to increase vaccine reporting, and to provide vaccination clinics for our community. Through this process, last year, the team were able to reduce the initial list of 1,794 students to 822, removing 54% of those students initially identified from the list. We hope to see similar numbers this year as we work through our suspension process. As we continue to move forward with this process, we are preparing to send out our suspension orders to parents and students who continue to have incomplete immunization records. These suspension orders will be sent out at the end of February, giving parents and students time to update their immunization records before enforcement of suspension begins on March 28th. Following this, students will be suspended from school for 20 days by order of the Medical Officer of Health under the Immunization of School Pupils Act. This suspension can be rescinded sooner than this, as long as the students' immunization records are updated. The health unit saw a good response through this process in the 2017-18 school year, realizing an 83% compliance rate in 17-year-olds and an 81% compliance rate in 7-year-olds. Also, with the 2018 annual service plan and budget submission to the Ministry of Health and Long-Term Care, we were successful in obtaining funds for and hiring another PHN for the Vaccine Preventable Disease team. This increased capacity enabled the team to complete a catch-up strategy that involved assessing the records for the 2003 and 2012 birth cohorts. This process has led to an increase in the number of complete records on file for those two cohorts, meaning that less children will face suspension in the 2019 to 2020 school year. Expansion of our program has also allowed for a total of 6 birth cohorts to be assessed in the 2018-2019 school year, which is an increase of 50% from the 2017-2018 school year. Ongoing immunization programs that ensure high coverage rates are needed to maintain low levels of vaccine-preventable diseases. Putting into effect ISPA is an important means to ensure our coverage and compliance rates remain high and students, parents, and our community remain protected against vaccine-preventable diseases. Thank you for your time. Any questions?
Thank you. I had no idea, had never heard of that before, that kids could be suspended for not having immunizations. That's wild. Port Bember, Columbus.
Thank you, Madam. For Chair. Question for you. Has anyone ever been suspended and not being able to graduate from high school because of the suspension process?
No. While the suspension process would go on their student file, it's not counted as part of that. You know how they count all of the absences up as to whether you can graduate or not. This one isn't included in that number.
Thank you. Thank you.
Board Member Rabbits.
Thank you, Board Chair. And through the Chair, to our presenter, I was interested in the March 28th, 2019 date as being set as when these suspensions would be issued or commenced and when they take effect. I was wondering if you could comment on how that date was obtained and just a little bit of maybe a comment on general flu season in general, and maybe if that's a myth that, you know, it's at particular times of the year, or what the relevance would be of that particular March date as being when the suspensions would be taking effect.
Thank you, through the chair to the board. Each year in the summer, we do a lot of planning with our Vaccine Preventable Diseases team to look at all of the processes that need to be put in place in order to run an effective suspension process. And then when we're doing that, we also look at the school calendar to see when would be an appropriate time and not include PA days, exams, those kinds of things. We also try and take into account our school immunization programs as well. So we are in the schools with the same team in September, January, and May to provide hepatitis B, HPV vaccinations, and meningitis C as well. So when we plan all that out, that's kind of how we come up with the date for suspensions. It generally doesn't change by much, maybe a couple of weeks, depending on school season and what's going on. And for the response to the flu question, I will hand that over to my colleague, Dr. Shanker, to speak on that one.
So the flu season begins in the fall and ends in the spring. I don't, just as a point of, for us to be clear, is that influenza vaccination is not mandated by the statute. So we do encourage people to get immunized, but it's not a requirement. So a child getting immunized from the flu or not would not be affected by if they were to be suspended or not. I hope that provides some clarity.
Thank you. Any further questions? I just have one, just more out of curiosity's sake. Has this ever gone to the Supreme Court? Like, there's so many people now that are so against it. It almost seems like a personal right kind of thing if you chose not to.
So, Madam Chair, I'm not aware of the legal framework, but if it's been challenged in the courts or not. I think that for people who have, there is a framework to provide exceptions for people who have a good faith objection in the statute itself. People who've had good faith religious objections, and there's a process by which individuals can be exempted in the statute. So there is some accommodation of those beliefs. I think as a public health matter, though, we really want to encourage vaccination because of the benefits. We think when we think of vaccine preventable illness, it's a big advancement in advancing the health of children in the community. The other thing I would share is that we loathe to suspend children from school, and we would work diligently, to avoid that situation. That going to school is a good thing for children.
Interesting. Thank you very. Board Member Huffman.
Thank you, Madam Board Chairperson. I get confused. I have to practice for the next one. I just want, this isn't so much a question, but just a couple comments. One, I want to speak as, as a parent who has gone through this process. It was just an issue of my son being vaccinated. I think it was a day or two before the recommended one, so there was a possibility of a suspension. But I just wanted to say that in terms of that, the school personnel, the health unit, and the family doctor, everyone works really quickly together to make sure that suspensions don't happen. And there is quite a process of notification. So it's not just all of a sudden someone shows up on your doorstep and said, your kids out of here kind of thing. So there is a nice process. And I just wanted to reply to your comment about the immunizations is that, yeah, I think they did take a big hit a number of years ago, and that was primarily, if I'm not mistaken, you can correct me, in terms of the link to autism, and I think that has now been debunked as not accurate, and the move back to immunizations is a big thing, and people who legitimately do the conscientious objector piece, that's a whole different, I wouldn't call them anti-vaxxers, correct?
Madam Chair, through the Madam Chair, I think that the strategy, it's entirely healthy for people to be skeptical about what authorities and public health officials and doctors would recommend. And nothing is really risk-free. You know, I think that when you look at the benefit to vaccination against the risks, the benefits against the risks, the benefits clearly outweigh the risks. As it goes to autism, I think there's no real scientific link between vaccination and autism. It's unfortunate that those arguments have been put forth as an opposition or for individuals who do not want to vaccinate their children. I hope that clarifies at least our perspective.
So we're clear, I'm not skeptical on the science piece. I know some people that are just so dead set against it, and so I never really even realized this. I wonder what's going to happen with their kids when they go to school, but they're not here in Norfolk, so we'll be okay.
So, Madam Chair, no, I didn't mean to imply that you were skeptical. Although I think a modern way of thinking about health services is that it's okay to be skeptical. It's just that once you're skeptical, one has to then make some informed choice. If I could share with you, one of the things that's really important for us in the public health service team is that we're here to help people make informed choices, not to tell them what to do, but hopefully with the knowledge and with the guidance and our perspective that they'll choose to make the right decision for them and their family.
Any further questions? Okay. So the motion is moved by Board Member Taylor and seconded by Board Member Huffman that Staff Report HSS 19-05 Immunization of School Pupils Act suspension process be received as information. All those in favor? Thank you very much. All right. So that is the end of that. As far as communication, we do have one item under communications from the Regional Municipality of Durham respecting a publicly funded oral health program for low-income adults and older adults? And older adults? Older? Do we have somebody? Nobody's presenting then, no? Okay. All right, so I have a motion moved by Board Member Taylor and seconded by Board Member Huffman that communication item A be received as information. All those in favor? It's carried. And is there anything under other business?
Not at this point. Thank you, Madam Mayor, Madam Chair.
So now I have a confirming bylaw for the proceedings, that bylaw 2019-03-BH being a bylaw to confirm the proceedings of the Haldeman Norfolk Board of Health at this meeting held on the 5th day of February 2019 be passed, signed by the Mayor and Deputy County Clerk and affixed with the corporate seal. That is moved by Board Member Taylor and seconded by Board Member Huffman. Councillor Columbus.
Yeah, it's something that slipped by me, and it's on page 4 of the January 15th minutes. Or the agenda package. At the end there, item 3, it's that council be adjourned at 3:09, and probably should read the Board of Health. Okay.
Thank you, sir. Okay, so that motion was moved by Board Member Taylor and seconded by Board Member Huffman. All those in favor? It's carried. And finally, a motion that this Board of Health be adjourned at exactly 3:00 p.m. Moved by Board Member Taylor and seconded by Board Member Huffman. All those in favor? Well, that is the easiest meeting we've had so far. Thank you. Thanks for those notes. Well, I thought maybe like order, like wards, like order of the state, you know? And I was like, well, maybe it is order.